Hey guys, now we'll be talking about the femoral triangle. What is this femoral triangle? It is a subfacial triangular space present in front of upper one third of the thigh below the inguinal ligament. Below the inguinal ligament, the base is directed upwards and apex is directed downwards. In living people, it is seen when the thigh is flexed, abducted, and laterally rotated. So why should we learn about this femoral triangle? Because this femoral triangle, it's a site for the femoral hernia, that is what do you say, the protrusion of the abdominal contents into this space, and the abscesses of the psoas muscle, and palpation of this femoral vessels, and lymphadenopathy, that is enlargement of the lymph nodes present in this region. Now coming to the boundaries of the femoral triangle. This is the base formed by the inguinal ligament. The medial border is formed by the adductor longus, that is medial border of the adductor longus, and the lateral boundary is formed by the medial border of the sartorius. So here you might get it out like, why can't this become a boundary? Why is only this becoming a boundary? Because we know that this adductor longus is not only forming the boundary but also forms the floor of the femoral triangle. It is present obliquely. It is present obliquely like this. So here this is forming the boundary and this is forming the floor. Therefore, only its medial border can become a boundary, not the lateral border, as it is forming the floor of the femoral triangle. Floor of the femoral triangle. This floor is gutter shaped. It is a gutter shaped. It will be having four muscles, namely iliacus, psoas major tendon, and pectineus, adductor longus. You can remember with this mnemonic like pit A or pit B, just like that. It's just a silly one, but still, anything, it could be easier for something to remember like that. This is the floor, but you have to know the sequence from lateral to the medial and medial to the lateral. From lateral to the medial, it comes iliacus, psoas major tendon, pectineus, and adductor longus. Adductor longus. Now coming to the roof. The roof contains the fascia lata, that means the deep fascia of the thigh, having the saphenous opening covered by the cribriform fascia, and this is covered by the skin and superficial fascia. This superficial fascia will be containing upper part of the great saphenous vein, femoral branch of the genitofemoral nerve, branch of the ilioinguinal nerve, superficial branches of femoral artery, femoral vein, and superficial inguinal lymph nodes. Superficial inguinal lymph nodes. Yeah, these are the structures. The superficial vessels of the femoral artery, femoral vein, the terminal part of the great saphenous vein, and femoral branch of genitofemoral nerve. So remember here, this femoral branch of genitofemoral nerve will be supplying the skin covering this femoral triangle. Skin covering the femoral triangle. Now these are the superficial structure and these are the superficial inguinal lymph nodes. Superficial inguinal lymph nodes. Now coming to the contents of the femoral triangle, namely the femoral artery, femoral vein, femoral nerve, its branches, lateral cutaneous nerve of thigh, deep inguinal lymph nodes, and also includes a femoral branch of genitofemoral nerve and fibrofatty tissue. Coming to the femoral artery. This femoral artery, it gives first let us talk about this orientation. It just transfers the femoral triangle, like it means it is going straight, no any spiral, no any curves, just like that. It's just going transverse like this. If you think this is a femoral vein like this, at the base it is I'm sorry yeah Yeah, if this is the base, and here the base, near the base is the femoral vein, femoral artery. This femoral artery is present lateral to the femoral vein, and at the apex it is present anterior to the femoral vein. So in the femoral triangle, it will be giving three superficial branches and two deep branches. The three superficial branches, namely superficial epigastric, superficial external pudendal, superficial circumflex iliac, and the deep branches, namely deep external pudendal and Profunda femoris artery. Profunda femoris artery. This profunda femoris artery, it is the largest branch of the femoral artery, which arises 3.5 centimeters below the inguinal ligament, and it spirals behind this femoral vessels and gives rise to lateral circumflex femoral artery and medial circumflex femoral artery. This medial circumflex femoral artery cannot be seen here. It disappears by passing between the tendon of psoas major and pectineus, while as this lateral circumflex femoral artery, it passes between the anterior and posterior division of the femoral nerve. So this is a femoral nerve which gives anterior posterior branches, and these anterior posterior divisions will be enclosing the lateral circumflex femoral artery. This deep external pudendal, it pierces the deep fascia. Actually, I'm sorry, it's not oriented like this. It will be like this. See, it pierces the it pierces the deep fascia and passes medially behind the spermatic cord and supply the external genitalia. Now coming to the femoral vein. Femoral vein, it accompanies the femoral artery like this. At the base it is present medial to the femoral artery. At the apex it is present posterior to the femoral artery. And it receives the great saphenous vein, profunda femoris vein, and also the veins accompanying the superficial branches of the femoral artery. Superficial branches of femoral artery. Now coming to the femoral nerve, it is present lateral to the femoral artery, outside the femoral sheath. Actually, femoral sheath will be present like this. So it is present outside the femoral sheath in a groove present between the iliacus and tendon of psoas major. Between a groove of these two muscles, it will be passing this will be passing behind the enters the femoral triangle behind the inguinal ligament, and it divides into anterior and the posterior division. This anterior division will be giving two cutaneous nerve. The one is intermediate cutaneous nerve and medial cutaneous nerve, and the posterior one gives only one cutaneous nerve, namely the saphenous nerve. Saphenous nerve, which extend down along the lateral side of the femoral artery, whereas this medial cutaneous nerve, it also accompanies the lateral side of the femoral artery, and at the apex, it crosses the femoral artery from lateral to the medial like this. Now, one more thing here is the lateral cutaneous nerve of thigh, which is a direct branch of the lumbar plexus L2 L3, enters the thigh behind the inguinal ligament or by passing through the inguinal ligament, and divides into the anterior branch and posterior branch. This will be supplying the skin of the anterolateral aspect of the thigh, anterolateral aspect of the upper thigh. So clinical aspect of this lateral cutaneous nerve of thigh is meralgia paresthesia. Here what happens is, as it passes through the inguinal ligament, it get compressed there, that lead to the pain and paresthesia of the upper lateral aspect of the thigh, called meralgia paresthesia. How could this be treated is division of the inguinal ligament and releasing the nerve from compression. Now the last component is the deep inguinal lymph nodes. There are three in number, present on the medial upper part of the femoral vein, on the medial side and in the upper part of the femoral vein. So there are three. The lowest one is present below the junction of the femoral vein and the saphenous vein, and the middle one is present in the femoral canal, called the gland of Cloquet or the Rosenmuller, and the highest one, this is present in the femoral ring.